It says live on Facebook.
Sweet. Let me just peek. Okay, I see it. Good. I'm just going to give people a minute to come on just because they were looking at that other link. I did like make a little comment on there. I was like, watch for us to go live because this one's not working.
No problem. I'm drinking my coffee anyway.
The technical difficulties have been real. Okay. People see us. That's awesome.
Yay.
All right. So as you guys are hopping on, say good morning.
Hi. Good morning, everyone.
So welcome, you guys. And, you know, this wasn't my original plan this week, but with everything going on, to hear this good news, I couldn't wait. We had to talk to her for her to share her story and her experience. So I want to introduce you guys to Justyce Robbins. She is a user of our product. She's been with Chicago for a while, right from the beginning, almost about a year. Perfect. So let's just cut right to the chase. Justyce, you got diagnosed with COVID, right?
I did. So I'm a cardiac sonographer at a major hospital in Boston. And I was obviously, we ran out of a lot of our protective gear very early on. And I was exposed to a patient who at the time they didn't know was positive for COVID. So obviously I didn't have anything but a small little surgical mask.
Were you doing the test because they were short of breath?
No, actually she came in for stroke. So yeah. So we didn't, sorry. Can you still see me?
Yep.
My people keep calling me. So nope, she was for a stroke. So we had no indication of that. And then, stop calling me. And then 2 days later, I got notified at work that she tested positive for COVID. So obviously they send you on a 14-day quarantine. They send you home right away. Which I started, God, I feel like I've been home forever.
Right.
So I don't even know what day it is, to be honest. So they sent me home for a 14-day quarantine. At that time, I had no symptoms. So I was asymptomatic and I was like, okay. And they at first didn't want anybody working at all if you've been exposed. Mm-hmm. The rules keep changing every day. It's kind of crazy. Which, as I'm sure, because no one really knows what's going on.
Right. And they need all hands on deck too.
So right. Yeah, they're getting to the point where they're like, if you feel fine, come in, just wear a mask. But so then a couple days later, I ended up getting a sore throat. But to backtrack, I had a symptom, which at the time wasn't labeled as a symptom, and I didn't know. I actually couldn't smell anything. So I lost my sense of smell, which was the weirdest thing I've ever gone through. Wow. I was literally sticking candles in my face, like trying to find some type of smell. I couldn't smell anything, but I felt fine. So I was like, oh, that's like super weird. And we were laughing about it at work, like, haha, like you can't smell anything, like smell my lotion. This is really small. This is really strong. But so no. And then when I got home, I want to say like 2 days into my quarantine, I got a sore throat. That's when it started. And it was very mild at first. And it started right at the top of my throat. And each day kind of made its way down. So I was like, you know what? They said all I need is one symptom to go get tested. So I'll just go get tested anyways, just to know. Mm-hmm. So I went to go get tested, and then it ended up coming back positive. So I did have the sore throat, and it traveled all the way down. And then it kind of felt like something was in my throat blocking my airway, which was kind of where like the shortness of breath came from. Okay. But then this also went, as days went by, it was like new symptoms kept coming up. Right. And it comes kind of very slowly, which was like, it's kind of like, okay, just get it over with all at once if you can. But it ended up getting into my chest. And for me, I have very bad asthma. So I was nervous from the start of this. Because of that, I've been hospitalized because of asthma before. So anything respiratory, I have an issue with. Obviously everyone does, but certain factors that people have will make this virus a lot worse than it needs to be. So once it got into my chest, I had that chest tightness. And to be honest, I thought it was going to be a lot worse than what it was for me. And I'm very grateful that it didn't end up with me being hospitalized. So because what I'm thinking is because right before I got the virus, I had started on the hemp and pea protein because I was doing a weight loss challenge. So I was using it as a meal replacement. And I was also, in between my meal replacement shakes, I was using the hemp super greens. So I was already on that for a good 2 weeks before I even got the virus. So to me, I was taking all these vitamins and putting all this good stuff in my body that I felt like that probably helped the virus kind of keep at bay, because it really could have been a lot worse than.
I just want to take a second, guys. We don't make medical claims. We're not here telling you that cannabinoids or greens or anything is going to cure, treat, prevent, or improve anything. This is literally just Justyce here sharing her story, and just kind of putting 2 and 2 together. But, you know, we're seeing that in the media and in the news, you know, to fuel your immune system, stay as healthy as you possibly can, you know, avoid certain things in order to fight this virus stronger and to be able to come out. I mean, look at you, you're smiling, you're glowing.
Yeah, no, I feel really good today. I do. I mean, the virus is still in me, but I feel a lot better.
So how long would you say that you were like sick?
Honestly, I think I really only had maybe 2 to 3 really bad days. And then the rest of the days were kind of just like, oh yeah, this kind of stinks. My throat kind of hurts. But it wasn't anything that I was like, oh my God, I can't get out of bed. I can't do anything. So.
And you know what's crazy too is, like, you know, a sore throat, that can be a number of things. So and especially right now, I don't know what it's like up in Massachusetts right now as far as the pollen count, but here in Virginia, the pollen count's crazy. Like, me and my family, we've been treating our allergies. I always get a sore throat with allergies and the postnasal drip. But like every day I'm like, do I have it? But do I have it?
I know.
But then when the sinus symptoms are coming with it, I'm like, I'm good. You know, we've been good. So I want to ask you, especially as a medical professional, what are some tips that you feel like you could share with others? First of all, to kind of help prevent. I know you said that you guys ran out of PPE, which for anybody who's not in the medical field, that's personal protective equipment. So masks, gowns, gloves. So what are some ways that you feel that people can kind of start doing now at home just to help prevent this?
Yeah. So honestly, this virus can stick to your clothes. It can stick to your hair, sticks to the bottom of your shoes. So for me, I would definitely suggest, if you are, so I'll do medical and I'll do regular, every day going out to the grocery store. For medical, I would, if you can, I would change at work and leave those scrubs or clothes there. And then change to come home. And then when you come home, always take your shoes off at the door. And then also, if you can, hop right in the shower, because I did not realize how much this virus can stay just in your hair. I mean, like it stays on your clothes and things for a few days, so it can just stay there. And then, so I would I definitely would suggest that for medical, even if at a regular job. Not saying that it's not like a regular job, but even at like your office, obviously, you know, wash your hands, sing the happy birthday song, whatever song you want in your head. And honestly, in my opinion, I think washing your hands is a lot better than using the Purell. I don't know what the fascination is with stealing all the Purell, but it really doesn't do. That's like a very quick fix, and it's really not washing your hands. Like,
we're only using it if we have to leave the house. Like
exactly.
we went to the grocery store the other day, and I literally was like using it every time I picked up something. Like, that's good for that. But I mean, to use that in place of actually really washing your hands, it really doesn't do anything. Yep. Another thing is, I've also seen a lot of people out before I caught the virus with gloves on, and that's okay, but you're using the gloves and then touching your keys or touching your phone, and then you're going to take the gloves off, and then you're going to touch those things again, and then as soon as you touch your face, you pass it on to yourself. So I wouldn't, the glove thing is kind of unless you're really, if you're using it in a medical sterile procedure, it really doesn't make sense to be around with gloves at the grocery store, because you're touching your groceries, you're touching the bags, you're touching your debit card or whatever it is, so it doesn't, because technically you should be washing with gloves.
Yeah, exactly. It's the same thing. So another thing too is the masks. It's okay to wear the masks, and that's fine. But when you come home, if you only have one and can't throw that away, that's fine. But I would put it in a bag. If you have a paper bag or a plastic bag, that's better. If you put that in a bag and kind of like leave it near the door, I wouldn't really like bring it into the house. Maybe spray it with some Lysol or something.
No, I've seen people, because I have a lot of nurse friends, obviously, so I've been watching on social media, before they leave for work, they're leaving their clothes and they're leaving sanitizer and things like that in the garage, right? So that when they get home, they can change right away. But you obviously want to clean yourself before you even touch your clean clothes.
Right. It's tough. It really is. It's hard.
And we should really be considering that if we do leave quarantine and we go to the grocery store, it's hard. So we should be considering those measures even when we leave the house, because like you said, I mean, you're wearing a hat, and I actually just thought to myself, I'm like, oh my God, that's brilliant to wear a hat to go to the store, because you're saving your hair and things like that. Put up a pair of clothes. I mean, there was this meme I saw from one of my nurse friends, and she's like, if you drive by my house and you see me naked on the front porch, don't judge.
Don't judge. Yeah, no, I know. I mean, it's honestly, it's tough, because it's like, you try to do all these measures, and I mean, I'll be honest, I did all these measures. I did all this. I was very like protective of taking my stuff off at the door and everything else, and I still caught it. I mean, it's like, you can only do so much, really, honestly. So I mean, I know a lot of people are kind of driving themselves crazy, like going over what they should do and really doing all these measures, but I mean, I did that, and I ended up getting it anyways. You know, so I don't know. I mean, it's tough, and it's tough with not knowing everything there is to know about this virus yet. That's the biggest thing. So it's like every day it seems like there's new guidelines and there's new measures and new information on it. I mean, another thing too is the diffuser and the essential. Yes, I do. I have it going literally.
That's awesome. That's awesome.
Yeah, I love it, and I kind of bring it everywhere in my house, and that cleans the air. So I mean, that's like a good thing too to have, just to, I mean, besides the Lysol and stuff that I'm sure everyone is just spraying everywhere, but that's another good thing. Did you get it
before you got sick? Did you get the diffuser?
No, I got it once I did get sick. I did get it after I was sick. Yeah, so that probably helped a lot too.
Did you notice a difference by chance?
Yeah, I mean,
no breathing or anything?
Yeah, so you know what? I have it on my nightstand next to me in my room, and I put it on like kind of a half hour before I go to sleep, and I let it kind of do its thing. I also really like the lights that's on it, so it's kind of soothing. It makes me fall asleep.
Right.
And yeah, no, I definitely can breathe a little bit better.
So that's our pure kavu essential oil blend. Oh, I love it. I have heard, so like we have it. I have several actually running throughout the house. Every room has one.
Yeah.
And we absolutely love it, even just for the smell.
Oh yeah, it smells really
alone. It's such a beautiful, clean smell. And all of my customers or anyone that I've heard using it really, really love it. And you're using the Kavu Shield as well. The disinfectant spray. Sorry. Yep. Hey,
yes,
awesome.
of course.
That's awesome. I love it.
Yeah.
Okay.
Yep, I've sprayed down everything you can spray down. And another thing too is I didn't, so I was supposed to self-isolate from my boyfriend who lives with me and my dog. Obviously I cried the first day all day, so they said it was fine for me be around them, and they as in my boyfriend and the dog. So I've been home for over 2 weeks. I've been home for a while, and he has zero symptoms. He has nothing. Yeah, and I mean, we're in the same room. We're not 6 feet apart.
Right.
So I've definitely been around him asymptomatic, symptomatic. I've been around him constantly, and I don't know, it could be because I'm cleaning everything. I got the air going. I've kept my symptoms at bay. So, I mean, he's been great. Yeah. He hasn't gotten anything, thank God.
Yeah. So you did mention a couple minutes ago that every day something's changing. There's new information that's changing, but there's some things that I notice aren't changing. They've been saying since day one, keep up on vitamins, stay hydrated, keep yourself quarantined, only be essential. Vitamin D is super important. So do go outside, just obviously maintain that social distancing. But those are some tips that, have not changed that I've been seeing as I follow doctors and everything around the world and nurses. So those are also some tips that I kind of wanted to throw out there. Obviously, don't overhydrate yourself. That's one thing I talk to people about all the time.
Yeah.
You can overhydrate. Anyway, that's another story. I won't get into that today. I'm just looking if there's any questions. Do you guys have any questions for Justyce? Anything in particular? I know I've seen quite a few people who are going out, getting tested, waiting on how long did it take for you to get results?
It took me 4 days.
That's incredible, because in other areas it's taking a lot longer than that.
Yeah. So I guess for Massachusetts, it's being sent to 2 different places. So one is Quest Diagnostics.
Yep.
And then the other one is the state is doing their own testing, I guess.
Okay.
So they have to send it out, and then it takes a couple days. But I have a couple people in my lab who've been tested, and one came back 2 days later, the other one came back 5 days later. So it honestly just depends.
Was there an outbreak at your hospital?
Currently, there are. I just read the email yesterday. I want to say there's over 100 employees.
Really? Okay, because a couple of days ago, I think there were 50, but
yeah, it went from 50 to double.
In Boston, they're kind of heading into that crisis situation. Thank goodness it's not as bad as New York, but Boston, the top medical hospitals in the world.
Yeah.
So, it's a good thing and a bad thing all at the same time.
I know. Yeah. So it definitely did for employees. It doubled for patients. It tripled. I mean, it's, I talk to my friends at work every day, and I mean, I can't believe it. I'm so like, I want to help everybody. So like me sitting here and I got knocked out so quick in the game.
I know.
Every day I'm like, I can't wait to go back to work. And everyone's like, why? You get to stay home. I'm like, oh no, I'd rather be at work.
Right.
I'd rather be
You
at
do
work.
what you do for a reason. And I totally, you know what, as a nurse who now works from home, I've actually had the same thoughts the last few weeks. I've been like, wow, I should be out there. I should be on the front line. I should be. And then I'm like, I look at my family and I'm like, oh, but no, I shouldn't.
Yeah.
You know?
Yeah.
So it is a struggle, you know, but I completely relate there. I'm just going to peek to see if no one had any questions. That's awesome. Okay. All right. Well, I don't have any more questions. Is there anything else that you feel like you want to say?
No, I mean, I'm open if anybody needs any questions they think of later on. They're always welcome to find me on Facebook. I'm willing to.
And you're tagged in the video too, so you'll see when people are putting questions.
Yeah, so
if they're watching the replay.
Yeah, I'll check back on that post, and if anyone has any questions later on that you think of, I'll be here. I'm stuck here, so.
I want to take a second to really thank you, because as much as you're sharing your story, which is a beautiful story, we don't hear many of those. I also know how hard this is right now. A lot of people are kind of, if they're finding out that they're exposed, people that they know are like, oh my God, I just saw you, or, you know what I mean? And people can kind of get a little bit of, not hate, but, just the negativeness, rather than lifting you up and, praying that you're going to do well. It's almost like, well, do I have to worry? So I applaud you for coming on, because I know right now it can be difficult to talk about this. And again, in such a dark time, it's so important to just have those little rays of sunshine come through. So it's awesome. Thank you so much.
Yeah, I mean, all you're hearing all day long is death tolls and negative things. So I definitely wanted to be a part of showing that the positive side of it, and that people do make it out of it. And I mean, I went through that when I first came out and said that I had it, thinking, I didn't think everyone was gonna like treat me differently, but I mean, a lot of people would message me and say like, oh my God, like you said, I just saw you 2 months ago. Am I gonna get it? I'm like, 2 months ago? Seriously? No, I mean, since this virus came out, I've been very careful about who I've been around and what I'm doing. So honestly, anybody who needed to be notified got notified, and they are all fine. So
good.
I mean, yeah, don't be afraid too. Don't be afraid to. I mean, if you want to reach out and privately message me saying that you have test positive, but I know a lot of people are afraid to say it, and a lot of people don't want it to be out there because people are kind of going a little bit crazy over it. It's a virus. It's just, I mean, it's just we haven't even hit our peak, to be honest. It's unfortunately.
That drives me nuts.
It
drives me nuts. I could get into it, but I won't.
I know.
I do. I want to just please encourage everyone, stay home. Yeah. Seriously, stay home. The longer we keep coming out of quarantine, the longer we're going to face this. So just
exactly. Yep. Stay home. I agree.
Thank you so much. You're awesome.
Of course. Thank you.
All right. You have an awesome rest of your day. And thank you guys who hopped on with us.
Thank you, everyone. Stay safe and healthy.
Stay healthy and sane is what I've been told.
That too.
Bye. Right. Bye, guys.